everybody. Welcome back to Daytime. Dr. Ron Nussbaum is back. He's the CEO of Back Clinics of Canada and a very good friend of the show. Welcome back, sir.
Thanks to have me.
Listen, a pleasure to have you on here because I suffer from back pain. People watching suffer from back pain. We've been lucky because the snow has not been here, so people don't have that shoveling back pain.
It's true.
Yet people are still ailing. Sometimes when it comes to back pain, it's the little things that make the difference, right? Like the way you stand or the way you walk, maybe?
Yeah, sure. It's your posture. It's the way you sit. It's the way you do your work. All of a sudden, you see Elaine standing up nice and tall. But you're quite right. It's the little things, if they're done incorrectly on a repetitive basis, they make what we refer to as repetitive strain problems. They may be small, but they can end up turning into a big problem.
I think it's something that no one's really taught people when they're young. I mean, I was in a choir for many years, and we were told we had to sit at the edge of our seats. And so I think that's taught me some good posture. But in general, when you're in school, you're always slouching, listening to the teacher. What can you do, possibly as a parent, to teach your children from an early age that posture is important?
Well, I think moms are probably one of the best teachers, and they tell you how to stand straight. And the reality is, posture is such a big determinant as to whether or not you're going to suffer back pain. So moms will tell you to stand up straight, and really what you want to do, and the viewers should really think about this because this can go a long way to preventing back pain. Stand up straight, and you want your ears over your shoulder. And that's really the main thing. You want to just imagine there's a plumb line going through the top of your head right down to the bottom onto the floor. Now, it's not always so comfortable when you feel like you're a robot, but it's an important thing because many people have this forward head posture.
FHP.
It's for real, and they don't even think about it until someone points them out to. And other times people will just slouch a little bit. That's a big deal because as time goes on, these things turn into bigger problems.
Little things become big monsters quickly. You have some diagrams here of what's symbolic of bad backs. Is that accurate?
Well, here's a spine. We bring this every time we come onto the show. This will just show you very quickly. Which camera shall I?
You hold it right where you are right there.
Around.
Don't move it.
Bones, vertebrae, discs, they're between them. And you'll notice that there are curves here, here, and here. The reason that your posture is so important is because it ends up affecting the strength and the position of these curves. Once you actually have poor posture, you end up putting more pressure in some of the key points, and that's what results often in very serious back pain that becomes such a big problem. 4 to 5 Canadians suffer severe back pain. It's the second most common reason why people visit the doctor at the
Now,
doctor's
are there
office.
preventative measures we can do in terms of exercises every day to help prevent?
Absolutely.
Yeah.
You know, we have a great system of care to treat patients with the care. Much better to prevent it. Maybe after the break, we can do a demonstration and show you a bunch of them.
I guess the question that a lot of people struggle with is when they think of back pain, they think it's a life sentence. They think they're always going to be stuck with it because it's your back, and backs rarely get fixed properly. Is it a life sentence, or can we change it?
Well, it unfortunately for many is, but it is changeable. You want to have better posture, of course. You want to lose weight if you can, and tighten up your core and do some exercises that can help you in that regard. So it does not have to be a life sentence. Even some of the more severe problems, we have a program called the High Performance Healing System that actually heals herniated discs and degenerative discs. So long are the days where it used to be a life sentence of back pain. It doesn't have to be that way.
Good.
Great, and so we'll talk about after the break as well. You're going to show us some postures, but what chiropractic care actually does to help the back with some pain and acute pain.
Absolutely. You want me to talk about that now or after the break?
We'll do that after the break. But
Believe
we're going to push this away.
Carlo?
We're going to push this away, and you're going to show Jeff some exercises on a mat. And all of you watching can copy and then see if that's going to help you as well.
Excellent.
And for more information, you can go to backclinics.ca. We'll be right back with more with Dr. Ron Nussbaum. Welcome back. We have Dr. Ron Nussbaum here, CEO of Back Clinics of Canada, and we're showing Jeff right? The proper postures and exercises to keep the back healthy.
Awesome.
Okay, so what do? I just assume the position on the mat?
Before you do,
Go ahead.
this is a list of a bunch of very important flexibility and strengthening stretches.
Yeah.
If your viewers want, they can contact us.
Don't move it, hold it
either
right
by
there.
going to backclinicsofcanada.ca
Yeah.
or sending us an email to contact@backclinics.ca, and we'll send them a copy of this in a PDF format.
Okay.
So let's start first with posture.
Yeah.
Do this. That's bad.
Not
So
good.
you want to stand up tall, shoulders back, ears over your shoulders.
If you feel like Mr. Burns, you're not in the right
Yeah,
position.
don't look up. Just look straight ahead. That's it. Now, if you want to turn sideways so the camera can see how your ears are just about over your shoulder, that's what you want to think about. So every once in a while, not narcissistically, but if you're passing by a mirror, check it. And if it looks like you're not doing that, that's a problem. Because
You know what
of
I
course,
find? I gotta tuck my shirt. I find that when you tuck in your shirt, it's difficult to get the right posture.
Is that it?
Pulling you in. Okay.
Okay. All right, so we're going to now do a series of flexibility stretches.
Yes.
We're going to first start with the pelvic tilt. So we need you to lay on your back, belly up, as
Belly
we
up.
say.
All right.
Knees are bent. Now you may notice, and Jeff, you can show the audience, if you put your hand in the low back, there's a little space there. So
Right here.
Exactly.
Okay.
So the objective is, what you want to do is you want to rock your pelvis forward and pull your belly button against the floor. So do that right now without lifting up the pelvis. You're
So
lifting
I'm
up the
doing the hips
pelvis.
right here?
Yeah,
Oh,
you
without-
want to rotate.
What am I doing now?
You want to rotate. There you go,
Yeah.
pulling the belly button down. Awesome.
Like a Pilates move.
Exactly.
Oh, yes. Great.
Okay. Now, I don't want anyone doing this if it's going to cause them any pain. So you can always contact us or your doctor.
And what is that strengthening
That's
when you are...
that's strengthening the pelvic wall and the abdominals as well.
And so how many repetitions and how long should he hold
Everybody's
for?
a little bit different. You would try within your own comfort zone. Try about 10 reps slowly. Next,
Okay.
we're going to do is sort of a rotatory
Yeah.
stretch. Have your knees together, and with your knees together as if they're glued, have them rotate to your right and your head rotate to your left. Okay?
It's
Yeah.
a stretch.
Yeah, nice stretch. You want to keep your shoulders pinned to the floor, and now go to the opposite direction, nice and slowly.
I've heard that twisting is very good for the back in terms of twisting, stretching.
Well, as long as it's not a quick twist, you're fine. Now, let's get back into the original position, knees up. I want you to bring both of your knees to your chest,
Yeah.
grab onto them, and pull them together.
Oh,
now,
there's not much space there.
for the audience, if you're having a hard time grabbing your knees, wrap a towel around your knees and draw them up.
That'd be
if-
beneficial.
Then, of
Okay.
course, you'd go back down. You could do one knee at a time
Yeah.
as well.
Quick question about these type of
Yeah.
exercises. Should you do them after you do some cardio to warm up your circulation, or does it not matter?
Oh, it does matter. Stretching is always good to warm up before you get going. Let's
Oh,
get you
before.
on all fours quickly.
So say you're doing a workout, it's best to do this after you've done the workout or before you do your workout? Like go for both.
Both, absolutely.
Both.
All right, now get your knees a little bit closer
Yeah.
and arch your back up. Okay. So that is the cat yoga pose.
Right,
Now,
that's what my cat does when
let's
she's
do the
angry.
opposite. Head up and arch it down here.
It's upward dog.
That's the upward dog. There you go.
There you
guys
go.
don't need me here. This is awesome.
So basically yoga is great for the back as well.
It's phenomenal. It's absolutely phenomenal.
Anything
so
else?
that's a good start. Any other questions about these
Well,
poses?
the thing is, after a while, I'm sure if you have back issues, that's not going to feel good.
Mm-hmm.
How long do you do this before you start to feel some improvement in your...
So you're raising an important question. This is, I like to see these as preventative stretches if you do this on a regular basis. If you're having a problem, you can attempt them. If you're not getting the kind of success that you want, please come and see a qualified doctor who specializes in this kind of work.
Backclinics.ca is the website. What are people going to find when they go to that website?
It's a very helpful website. There's lots of videos explaining the different kinds of problems that we treat. And again, they can find our contact information so they can get a copy of this set of stretches. They'll learn about the high performance healing system, the laser system
Yeah.
that we're the first clinic in Canada to have
So
that heals the discs.
If we come to your clinic, do we always see you?
I'm the guy.
Excellent.
And my
Man.
staff.
Good.
Okay, great. So if you have back pain and you're
Mm-hmm.
looking to feel healthy again with posture and your neck, go to backclinics.ca. We'll be right back with some giveaways after this. Thank you so much.